Hello, David. It's good to see you. Come on in, have a seat. Make yourself comfortable. What brings you in today? How can I help you? Dr. Smith asked, gesturing to the chair opposite his desk. He could see the worry etched on David's face.
Thank you, doctor. I appreciate you seeing me on such short notice. I've been having really bad stomach cramps and, well, let's just say I haven't been too far from the bathroom all day. It's been quite distressing.
I see. Dr. Smith nodded, his expression turning serious. He leaned forward, giving David his full attention. Can you tell me more about these cramps? When did they start? How severe are they? Have you experienced anything like this before?
They started yesterday evening and they've just been getting worse. The pain is almost unbearable at times. I feel so weak and dehydrated too, David added, a hint of fear creeping into his voice. I'm really scared, doctor.
David's worry was evident, his anxiety palpable as he sat in the waiting room earlier, and Dr. Smith's concern grew as he listened. He knew he had to get to the bottom of this quickly to provide relief and reassurance to his patient. Dr. Smith took detailed notes, making sure to capture every symptom David described. He wanted to ensure nothing was overlooked. Have you noticed any other symptoms? Fever, chills, or anything unusual? Dr. Smith asked, trying to piece together the puzzle. No, just the cramps and the frequent trips to the bathroom, David replied, shaking his head. We'll figure this out, David. You're in good hands, Dr. Smith reassured, offering a comforting smile. Let's run some tests to get a clearer picture of what's going on. We'll start with some blood work and a few other diagnostics. David nodded, feeling a bit of relief knowing that steps were being taken to find the cause of his discomfort. Thank you, doctor. I really hope we can get to the bottom of this, David said, shaking Dr. Smith's hand. We will, David. We'll get you feeling better soon. Dr. Smith replied with a reassuring smile.
Have you had any other symptoms, David? Fever, vomiting, anything like that?
Yes, actually, David confirmed. I've been vomiting quite a bit and I feel a little lightheaded, especially when I stand up.
All right. And have you had any recent travel, especially to areas with poor sanitation? Dr. Smith inquired, his eyes fixed on David.
Not recently, no, David responded, shaking his head, but I did eat some street food a few days ago. I remember thinking it didn't seem quite right.
Dr. Smith continued to gather information, trying to piece together the puzzle of David's symptoms. He knew that these symptoms could be indicative of a range of issues, from food poisoning to more serious infections. Dr. Smith asked, Have you noticed any changes in your bowel movements, diarrhea, or anything unusual? David thought for a moment before replying, Yes, I've had some diarrhea as well. Dr. Smith nodded, making a note of this new information. Any abdominal pain or cramping, he asked. Yes, quite a bit, David admitted, wincing slightly as he spoke. Dr. Smith considered the symptoms carefully, knowing that a proper diagnosis was crucial. It sounds like you might have a gastrointestinal infection, he explained. We'll need to run some tests to be sure. David looked anxious but nodded in agreement. Okay, let's do it, he said. Dr. Smith reassured him. We'll get to the bottom of this, David. Just hang in there. With a firm handshake, the doctor and patient solidified their commitment to finding a solution. Dr. Smith began writing a prescription for some initial medication to help alleviate the symptoms. David took the prescription, feeling a glimmer of hope that relief was on the horizon.
I understand your concern, David, Dr. Smith began, leaning forward in his chair. What you're describing could be a number of things, and it's important not to jump to conclusions. One possibility is cholera, which is a bacterial infection that spreads through contaminated water and food, he continued. The bacteria release toxins in the intestines that cause severe diarrhea and vomiting, leading to rapid dehydration if not treated promptly.
Dr. Smith's calm demeanor and clear explanations helped ease David's anxiety, even as he processed the information.
So how does cholera spread exactly? David asked, keen to understand more.
Cholera is often found in areas with inadequate sanitation, especially where water sources are easily contaminated with sewage, Dr. Smith explained. This can happen during natural disasters, in overcrowded refugee camps, or even in areas with poor hygiene practices. Consuming contaminated water or food, even in small amounts, can transmit the bacteria and lead to an outbreak.
Dr. Smith paused, allowing David to absorb the information before continuing.
What are some other signs of cholera, doctor? I just want to make sure I understand the full picture.
Well, besides the severe diarrhea and vomiting you've already described, other symptoms include muscle cramps, rapid heart rate, and low blood pressure. In severe cases, untreated cholera can lead to shock and even death due to extreme dehydration. However, it's important to remember that not everyone infected with Vibrio cholerae, the bacteria that causes cholera, will experience severe symptoms. Early detection and treatment are key.
Dr. Smith's tone remained reassuring, emphasizing the importance of early detection and treatment.
To be sure of the diagnosis, David, I'd like to run some tests, Dr. Smith continued, picking up his prescription pad. We'll need a stool sample to confirm the presence of the cholera bacteria. This will help us determine the best course of treatment. In the meantime, it's important to stay hydrated. Drink plenty of fluids, such as oral rehydration solutions or clear broth.
David nodded, feeling a renewed sense of hope now that a clear plan of action was in place.
While we wait for the test results, let's discuss how to prevent cholera in the first place, Dr. Smith suggested. Cholera is a serious bacterial disease that can cause severe dehydration and even death if not treated promptly. It's crucial to understand that prevention is always better than cure. The most effective way to prevent cholera is to ensure access to safe drinking water and proper sanitation. This means that communities need to have a reliable supply of clean water. Governments and organizations must work together to build and maintain infrastructure that provides safe drinking water to all. This includes washing your hands thoroughly with soap and water, especially after using the toilet and before handling food. Hand hygiene is one of the simplest yet most effective ways to prevent the spread of cholera. It's important to educate everyone, from children to adults, about the importance of regular hand washing. When traveling to areas with poor sanitation, be cautious about consuming food and drinks from street vendors and opt for bottled water instead. It's also wise to avoid ice in drinks, as it may be made from contaminated water. Always peel fruits and vegetables yourself to ensure they are safe to eat. With a warm smile, Dr. Smith concluded, "Remember, David, knowledge is power. By staying informed and taking proactive steps, you can protect yourself and your loved ones from cholera." It's not just about individual actions, but also about community efforts to improve sanitation and hygiene practices. By understanding how cholera spreads and taking the necessary precautions, we can effectively combat this preventable disease. Education and awareness are key. Communities must come together to support initiatives that promote clean water and proper sanitation. Together, we can make a significant impact and reduce the incidence of cholera worldwide. Community engagement is essential. Local leaders and health workers should organize workshops and meetings to educate people about cholera prevention. Sharing information through various channels such as social media, posters, and local radio can also help spread awareness. Schools play a vital role in educating the younger generation. Incorporating lessons on hygiene and sanitation into the curriculum can instill good habits from an early age. Children can then take this knowledge home and influence their families and communities. Distribution of hygiene kits, including soap, water purification tablets, and informational pamphlets, can also be an effective measure. These kits can provide immediate relief and help prevent the spread of cholera in vulnerable areas. As David left the clinic, he felt empowered with the knowledge he had gained. He knew that by taking simple yet crucial steps, he could protect himself and his community from cholera. Dr. Smith's words echoed in his mind. Knowledge is power, and together we can make a difference.